Personalized medicine is taking into account your goals, your preferences, and your priorities, and putting it all together with your biomarkers to make sure that we build a trajectory that is in line with your future goals. And we optimize your function and keep you as healthy as possible for as long as possible. So, in order to do that, we can decide what category you are among one of these three. So the first category is health enthusiast. So these are the people who will go above and beyond to do whatever is necessary to stay healthy. And they don't mind spending a little bit extra or even a whole lot extra, and to make sure that they are ahead of all the preventative exams. If they have any concern about their health, they will do whatever is needed to fix it and stay in an optimal health level at all times. They usually live very healthy lifestyles, and they just don't mind investing in their health because they see it as an investment. Then the second category is health moderates. So these are the people who will do whatever is necessary within the guidelines, and they will follow all the routine preventative exams, testing, and whatever is needed. They're usually healthy, but sometimes they fall off the wagon, and they don't mind keeping their routine appointments, but they don't necessarily want to go above and beyond that. And this is also a very good, very fine category. There's nothing wrong with one or the other. And then the third category is the occasional visitors, and these are the people who basically don't want to engage with the healthcare system. They don't necessarily want to go see their healthcare provider. They often you hear them saying that I haven't seen my doctor in a long time, or they don't have a primary care doctor, and they just basically just don't have the time or sometimes the means to do so. And so they will basically engage with the system whenever is needed, and preventative exams are not necessarily a part of their of the profile. So the health enthusiasts, the health moderate, and the occasional visitors, all these three categories are just fine. There's nothing wrong with one or the other. They're all actually very practical categories, and there are all kinds and there are people in all of those three categories. So it's not a question of judgment. It's not a question of if whether one is better than the other, or one will do better than the other even in the long run. It's a matter of identifying it and knowing what category you are, because if we know where you are, then we can design a plan accordingly. So if you are, for example, a health enthusiast, then I know how far I can go and what I need to do to align my plan with your goals so that we are on the same page and we achieve the maximal benefit or the maximum outcomes that way. And if you are a health moderate, then also I know what are the confines where we need to go, at what point we need to basically hold back, and what would be the how I can design then the future trajectory of your health. And if you're an occasional visitor also, then also my services are available to you. It doesn't mean that this is a category that needs to change itself. It's just that this category is where your preferences are at this point in life. So we can just stay there, and even then make sure that whatever is needed or whatever can be done, we do it to align it with your goals and preferences. So after we've decided what category you are, we can basically move with that. And people can move from one category to another at any point. So for example, I may be a health enthusiast at some point, but then other times I may just decide that I know I'm going to hold back, or I'm going to not pay too much resources or time or my focus on this because I have other priorities in life now. So people can move from one category to another. It's just that if we know where you are, then we can design everything accordingly. That is personalized medicine. Now, after we've done that, then we can take care of a few additional things. So before you plan your first visit or even your subsequent visits, it's a very good idea to make a list of all the topics that you need to discuss. And so this way you are very prepared, and then we also know what to expect. Make a list of your symptoms. Oftentimes people have symptoms from all over the place, and if they are not organized, then it ends up wasting a lot of time. So make sure that your symptoms are categorized and they are listed at least. The next thing to do would be to make a list of your past medical history. So whatever your diagnoses are, make sure they are put together in a list form. And then the very important thing to do would be to make a list of your medications and your supplements, because if they are not in order, then also it will take a long time to go through all of those. So these are some of the few things that can be done before the visit so that we can make the most out of the office visit and make the best use of it, and then start this journey together where you are healthy and you stay healthy for as long as possible, as much as possible. Thank you.